Welcome back, friends, to the podcast. The patient's voice doesn't matter. This is a place where your voice will always matter to me. Healthcare is extremely complicated. So I wanted to create a space where we will discuss tips and hot topics, provide resources, and have guest speakers who are experts in the healthcare industry or real patients sharing their patient experience in hopes of helping you navigate any healthcare setting. I want to focus on you, the patient, and discuss issues that matter to you in an open and transparent way. I'm your host, Krista Hughes, the founder and CEO of Hughes Advocacy, in which I am a board certified patient advocate. I have a passion for patients. Let's be the change together. So in this episode, we're going to discuss a serious topic on which I have previously podcasted, and that's diagnostic errors. They are a tremendous issue in our country, especially for rural patients and older adults. And actually, it infuriates me that I'm having to do another podcast on it because patients have got to start becoming aware of this serious crisis in our country. Now, as always, I will start the show with a "What would you do" segment. Then we'll transition into "Let's talk about it." And then finally, I'll wrap up the show by giving you tips on how to make your voice matter in this situation. So let's get started with what would you do? Imagine being in your 70s with several comorbidities. You go to see your electrophysiologist, which is a certain type of cardiologist, because you're having some serious heart and breathing issues. And he recommends some medication changes and wants you to follow up with your primary care physician to assist in coordinating your care for referrals and next steps. For 4 weeks, you attempt to contact your primary care doctor. Your health is declining and you're getting worse. So what would you do? Now let's talk about it. What is a diagnostic error? A diagnostic error happens when a doctor or a healthcare provider doesn't recognize the right issue. They get it wrong or they take too long to figure it out. This can lead to incorrect or delayed treatment. Now, there are several types of diagnostic errors that can affect patients, particularly these in rural and older adults. So I'm going to give you a breakdown with some simple explanations and examples of the different types of diagnostic errors. So one, there's a missed diagnosis. So what does that mean? The doctor doesn't recognize that there's a health problem at all, and the condition goes undiagnosed. For example, an older adult might go to the doctor feeling tired and weak. The doctor assumes this is just part of your aging and doesn't run tests, and they might miss a diagnosis for anemia or thyroid issue. The patient may leave without treatment, and their condition could worsen over time. Another example is a client that I have, and the was seeing the doctor and had this horrific cough. Like, it was bothering me how disturbing this cough was and interrupting our conversations, that I had to ask, should we do something about this cough? Has this cough been checked? Have we done an x-ray, XYZ? At that time, the doctor then, because we had to ask for it, had missed the diagnosis that this client was coughing and had pneumonia. Another type of diagnostic error is a delayed diagnosis. And that's when the correct diagnosis is made, but only after a delay, which may lead to the conditioning worsening. For example, an older adult has mild chest pain and shortness of breath, but the doctor thinks it's due to indigestion and does not order further tests. After the symptoms worsen, A later visit reveals that it was actually a heart attack. The delay could have led to more damage to the heart, making treatment more difficult and the recovery longer. Another example of delayed is I had a client that contacted me. They had been diagnosed with stomach cancer. As I was helping coordinate getting the medical records to the oncologist, it was discovered that the facility had lost the biopsy results, which this patient had to have another biopsy, delaying the diagnosis. Or another delayed diagnosis is that same client who needed the biopsy was on Eliquis for their heart, which is a blood thinner, and they could not safely do the procedure until the cardiologist, told us how many days he needed to be off the Eliquis prior to this procedure, and they never called. That is delaying a diagnosis. Then there's a wrong diagnosis or a misdiagnosis. And what that means is the doctor diagnoses the patient with the wrong condition. The patient may even get treatment for something they don't have, while the actual condition goes untreated. For an example, an older adult has trouble sleeping, feels weak, and has low energy. The doctor diagnoses them with depression and prescribes antidepressants. And I see this too common and it drives me insane. But however, the patient actually had an underactive thyroid and the antidepressants wouldn't help. And the thyroid issue will continue to go untreated, potentially causing more harm and health problems. I had a client, as another example, that was, by the time he contacted me, he was being treated for cancer, chemo and all, never had cancer. Then there's an overdiagnosis, and that's when the doctor finds a condition that may not actually need treatment, leading to all those unnecessary tests and treatments and doctor's appointments and anxiety for a patient. For example, during a routine scan, a small harmless growth is found in the lung of an older adult. Even though this growth might never cause issues, the doctor orders further tests or even surgery. These extra steps can be risky, especially for older adults. And then there's a partial diagnosis. And what that means is the doctor recognizes part of the health problem, but misses another related condition, leading to incomplete treatment. And an example of that is an older adult complains of stomach pain and constipation. The doctor diagnoses them with IBS, irritable bowel syndrome, but misses that the patient also has a UTI. The IBS got treated, but the UTI did not, which is indicative of a partial diagnosis. And then there's failure to recognize. So what that means is the doctor makes the correct initial diagnosis, but doesn't recognize the complications that can come with that condition. So to recap, because I know that was a lot, the key takeaways for the 5 top types of diagnostic error are a misdiagnosis, the condition is entirely overlooked. A delayed diagnosis, the diagnosis is made, but it's too late. A wrong diagnosis, the patient is treated for the wrong condition. An overdiagnosis, a harmless condition is identified, leading to unnecessary treatment. And finally, a partial diagnosis. Only part of the problem is diagnosed. I know that was a lot, but it's important that you pay attention to these because it is I'm going to say it again, it's a tremendous problem and it's getting worse and it's occurring at a higher rate. And actually I have added resources and literature in the notes section that you can go read on the crisis that we're having in our country when it comes to diagnostic errors. So why are older adults more at risk? Well, as we get older, our bodies have different health problems. And older adults are more likely to have multiple health conditions, which makes it difficult for doctors to pinpoint exactly what is going wrong. Sometimes the symptoms are unusual or hard to describe by the patient. That's why it's important for you to do your homework and prepare for these appointments, because sometimes it's not the doctor's fault, it's the patient is not giving them all the information they need. And a great tool to use is AI, Chat GPT, because by you not giving all the information also makes it easy for things to be missed. Now, a quick statistic. Studies show that about 10 to 20% of older adults experience a diagnostic error when they go to the doctor. That's alarming. This is a significant number, which means it's important to be aware of this issue. Around 12 million Americans are affected by a diagnostic error annually. You're not immune. Nobody's immune from this. So why are they a patient safety issue? And why does it matter? When a doctor doesn't get a diagnosis right, it can lead to serious health problems, and especially for these rural population or older adults. A wrong diagnosis might be, you might be given a wrong medication you don't need, which could lead to side effects that could worsen your health. Research shows diagnostic errors contribute to 1 out of 10 patient deaths. They're the leading cause of patient harm. And to people who already have health problems. I can't stress enough. I try to tell so many people, like, don't trust the healthcare system. Don't trust the healthcare system. You've got to be proactive with your health, because this is a concern that is going on. An example of that is if a patient has pneumonia, but the doctor thinks it's just a mild cough, like I was saying earlier, that patient might not get the right treatment in time, and the illness can get worse. Like I said earlier with the patient that was coughing, I could clearly, and I'm not a doctor, could tell that something was wrong. And I don't know how that happened, but got a wrong diagnosis and ended up, he had pneumonia. They're just older adults and rural populations are just at a higher risk. They have different symptoms. They have heart diseases, or infections that can look different in older adults. A heart attack in a younger person might cause a sharp chest pain, but in an older adult, it could show tiredness, trouble breathing, and that can be confusing to doctors. Older adults often have several issues at once. And we know this, they can have diabetes, COPD, congestive heart failure, and that makes it harder for the doctor to figure out which one of those comorbidities is causing the problem. If someone has arthritis and a new pain starts, it might be mistaken for arthritis pain, but it could be a different issue. 50% of older adults have 3 or more chronic, which means long-term health conditions, which can complicate diagnosing new problems. And I see this all the time, and I completely get it. That's why I try to, with my clients, keep them prepared, coordinate care, keep everybody up to date, manage your medications, write your symptoms down. There's so much you can do to help your doctors not have a diagnostic error happen to you. Older adults have memory and communication challenges. Some older adults have trouble remembering or explaining their symptoms, especially if they've got memory problems. If someone has memory loss, they might forget to mention pain in a certain area, making it harder for the doctor to diagnose the problems. I sometimes make my clients keep a symptom tracker, a little notebook beside their chair or their bed. And if they notice something new, just to write it down, because, your doctor's appointments are 3, 6, a year apart, and you're not going to remember. But if you write them down with a time and a date, it helps doctors diagnose a problem that you are going to see them about. So there are some consequences for patients that experience diagnostic errors. There's health implications. A delayed treatment for like cancer, heart disease, or infections all that does is worsen your problems. If you don't get diagnosed like for cancer early on, I mean, the road to recovery and your treatment plan is so much more laborious than if you catch it at the beginning. So that's a consequence that happens to the patients that they have to endure. They have an emotional impact. A misdiagnosis leads to stress, anxiety, and complete loss of trust in the healthcare system. There's a financial cost, which all of us know about the financial burdens of healthcare. Multiple consultations, doctor's appointment, tests, and treatments due to these diagnostic errors can lead to overwhelming medical bills, which is a financial burden to patients. So how can older adults and families prevent diagnostic errors? I've been saying this the whole time. Actively engage in your health. Prepare for your appointments. Bring a concise list of symptoms, questions, and your relevant medical history. Take notes. Write down what the healthcare provider says during the appointments to remember the details. Some doctors do not mind if you record your appointment so that you can go home and re-listen to that so you don't forget any of the details. This is a big one I have with older adults, and it's being completely vulnerable and open to your doctor. Try to share every symptom, even if it feels small. For example, monitoring feeling unusually tired can lead your doctor to understand more of what's going on. So there's no detail that's too small. Just talk to them about everything. Keep good health records. Write down your medications, your recent tests, and again, the symptoms. I'm going to keep saying symptoms. Write down all your symptoms because it makes it easier for the doctor to get the complete picture. I tell my clients, your body's like a piece of puzzle, and if there's a piece missing, they cannot fully diagnose you. So sometimes it's the healthcare system's fault for these diagnostic errors, but sometimes it's lack of you informing your doctor. Seek second opinions. I don't know why everybody's scared to get a second opinion. When in doubt, or if your diagnosis seems unclear, there's no treatment plan, consult another doctor. And this is especially crucial for serious conditions like cancer, a heart problem, neurosurgery. Do not ever be scared. Good doctors they actually say, go get a second opinion. So don't ever be afraid to get in a second opinion. It's your right as a patient. Studies show that getting a second opinion can lead to a 10 to 20% change in your diagnosis. Sometimes just by double checking with these second opinions can reveal new information and lead to the right treatment. Ask questions. Do not ever be afraid to ask questions. I've had multiple conversations with doctors, and it's kind of a fact. They respect you asking questions because it shows you really care about your diagnosis and your treatment plan. By not asking any questions, they just think you either understand or you don't care or whatever. Ask questions. Don't be afraid to inquire why a particular diagnosis was made, and are there alternatives? Are there holistic alternatives? You don't have to just do what they say. And this can prompt the doctor to start thinking about other treatment plans. So don't be afraid to ask and speak up. Know your test results. I said it earlier, the client that the biopsy was lost. If they had been checking, and this was pre them hiring me, if they had checked right after the biopsy results and asked and called the doctor and said, I want to know where my biopsy results are, maybe they wouldn't have lost them. Maybe they could have found them. But you've got to know your test results. Follow up on all of them. In healthcare, the no news is good news is not true. Especially like in your patient portal, most of your tests now, if you're active on your patient portal, you will It's immediate. If you have an MRI, you're going to get the radiology report. So know your test results and also use your portals. I know some people don't like it. Get family or friends to help you, because your patient portal tells, excuse me, your labs, your progress notes, appointments that you have. It's your medications. So keep up with your patient portal. It is crucial for you owning your own healthcare. And it also helps preventing a diagnostic error happening to you or your loved one. So I know that was a lot, and we've reached the final segment where we're going to discuss tips on how to make your voice matter. So remember the scenario at the beginning of the podcast where the client was ignored by their primary care doctor? Well, as this patient's advocate, I was furious. I reached out to the CEO of the facility and the chief patient quality officer to escalate our concerns. Well, the CEO punted it, didn't want to help, and sent it to the patient and quality officer. And this executive took up for the healthcare system. They denied the issue, delayed the care for the patient, just flat out lied to me, had the wrong medical information, blamed the medical issues that this patient was having on obesity, gaslighted me, talked down to me, and the patient continued not to receive care that was needed due to their arrogance and no accountability by the healthcare system. I immediately got the patient out of that healthcare system as the harm continued to occur, and they did not care. And since getting a new primary care physician for this patient, he got the meds he needed. He found out he had severe cardiac issues and needed to see a pulmonologist. I filed several complaints at the local, state, and federal level because I'm concerned that if this is happening to this one patient, it's happening to others, and that infuriates me. So always, if you're being mistreated, you can file a grievance. Make your voice matter. Stand up for yourself. Get second opinions. File these complaints and do what you need to do to get the medical care you, the patient, need and deserve. You do not have to be treated like this. And there is no reason a diagnostic error should happen to you as long as you do your part and stay on top of the healthcare system. So in summary, diagnostic errors are common, especially for the rural populations and older adults, and can lead to serious harm if conditions aren't treated correctly. By communicating clearly, keeping good records, and asking as many questions as you need, you as a patient and their families can help reduce the risk of these serious patient safety diagnostic errors. Understand the types that we talked about earlier of diagnostic errors, because if you understand them, it can help you be more proactive. And make sure that the healthcare team considers all possible conditions and complications to include all of your symptoms. That brings us to the end of this episode. I hope this topic was beneficial to you. As always, thank you for listening. And until next time, take care of yourselves, be proactive, and take care of each other. Make sure you do check out the resources in the show notes. Like I said, it is an extreme issue going on in our country. And be informed. If you enjoyed the show, please follow, rate, and review me on Apple Podcasts, Spotify, and Google Podcasts. And also, if you ever need anything independent, please reach out to me privately if you need help navigating any kind of healthcare system issues that you might be having. Until then, this is Krista Hughes. Don't forget, I have a passion for patients. Let's be the change together. Thank you.